A tragic story about a Lorain County woman who's suing Case Western Reserve University and a prominent surgeon after her husband died in the dental chair.
Happened while he was having what many of us consider to be a routine procedure. 19 investigator Mike Mason has a story you'll only see on 19 News.
In a few weeks, the state dental board will hear the details surrounding this incident. In court filings, both Case Western and the surgeon claim they're not at fault.
Dr. Faisal Qureshi is regarded as a brilliant surgeon. His website states he performs dental, cosmetic, and reconstructive surgery. Between 2023 and 24, he was president of the American Board of Facial Cosmetic Surgery. And his 82-page resume that was filed in court is impressive. Now Qureshi's facing a wrongful death lawsuit and possible discipline by the state dental board because of what happened in August of 2023. The lawsuit claims Qureshi caused the death of 48-year-old Matthew Miller during a procedure to extract 3 of his teeth at the Visage Surgical Institute in Medina. Miller's wife filed the lawsuit in court a year before the state dental board notified Qureshi of his opportunity to have a hearing in this case. The board claims Qureshi assigned a research fellow to assist him with the surgery, but that student wasn't licensed to practice dentistry. Qureshi's attorney will soon have a chance to argue his case before the board in Columbus. According to the lawsuit, that student attended Case Western School of Dental Medicine, where Qureshi served as program director. In court filings, Case Western denies Miller was under their care, therefore releasing them of liability. The lawsuit alleges Qureshi pushed to have Miller's procedure done under general anesthesia. The dental board says Miller was morbidly obese with a high risk that he could stop breathing during the procedure, and his condition demanded a full evaluation by a physician prior to the surgery. According to the board's hearing notice, Qureshi didn't do that.
Dental implants and complex procedures as well.
Dr. Connor Kylander didn't comment on Qureshi's case, but he did say some patients are not suited for surgery.
Are there any cases where you would deny a patient?
Oh, absolutely. I deny people all the time.
At Kylander's practice, he does everything from routine dental work to complicated surgeries. When he does, he says he takes precautions.
And we will go ahead and just do some due diligence. So we'll talk to their primary care provider, their specialist.
Pulse ox, blood pressure, 3-lead EKG.
Lisa Jadasic is a board-certified anesthesiologist who partners with Kylander. She didn't talk about the Qureshi case either, but says when she's called to surgery, she brings life-saving equipment that can fit right inside her SUV.
We're also prepared for any emergency, just like a hospital is. We just bring it in smaller containers.
And the dental board claims there was an emergency during Miller's operation. According to the board, while administering anesthesia, Qureshi gave Miller medications one after the other without pausing. They maintain Miller lost his pulse and went into cardiac arrest. The board contends Qureshi failed to give Miller reversal drugs needed to counter the narcotics that Qureshi used to put him to sleep. According to the lawsuit, Miller spent 4 days in the hospital on life support before he died. 19 Investigates reached out to Qureshi's attorney for comment. In an email, he said, "I would caution against reporting that the dental board has made any findings. The allegations in the board's notice of opportunity are just that, allegations. They have not been proven or established as fact."
The dental board also claims Qureshi changed the anesthesia records or allowed somebody else to after the surgery. In court filings, he denies this. Case Western won't comment on pending litigation. The board's hearings begin next month. We'll, of course, keep you posted. Mike Mason, 19 News.